Hello, everybody. I am your host of the Root of the Matter podcast, Dr. Rachel Carver, and today I'm bringing you a shortened solo podcast all about heart disease. So, as we may know or may not know, February is Heart Disease Month. So, even though I did a podcast in really good detail last year, I really want to reiterate the same topics again this year. Heart disease remains the top killer of both men and women globally. And even after decades of research and dozens of medications, it still remains the top of all humans. So, what's going on here, folks? If we have all these medications, why haven't we ticked the needle down at all? Perhaps it's because we're not actually addressing the root cause of heart disease. So, again, I want to reiterate this. They tell us that we need to hear something 7 times for it to stick. So, if I have to do this for the next 5 years to get that 7, then I certainly will, because this is really crucial and heart disease is completely reversible. I think that's one thing that a lot of us don't realize, although if you're listening to my podcast, you probably do understand that if we understand the root cause of disease, we can completely reverse and recover from just about anything. So, in conventional wisdom, the top 3 causes of heart disease are high blood pressure, heart disease, including like heart attacks and strokes, right? Any kind of vessel disease. So, it's listed as high blood pressure, high cholesterol, and smoking. Those are listed as the 3 top causes of heart disease. And so, because we have medications that can treat high blood pressure, can treat high cholesterol, and we can, get counseling to help with the smoking, that's kind of where the conversation ends. So, somebody may be put on a couple of medications and then, they believe that they're doing everything they can to reverse their heart disease or at least mitigate it getting any worse, right? So, but nobody seems to be asking, why is my blood pressure high? Why is my cholesterol high? And recent research really shows that we have to, kind of turn that conversation away from this high lipid profile, right? The so-called bad cholesterol, the LDL. If you've been listening to my podcast for a while, we talk a lot about the so-called, in quotes, bad cholesterol, which there's really no such thing, right? LDL is a response to something happening in the body. It is not your liver doing something wrong. It is not your body going awry. The body knows how to work perfectly. I've talked about this in some other podcasts. When we think about autoimmunity, we tend to think of it as the body going wrong, the body going haywire. It's attacking itself. In fact, it's doing exactly what it's programmed to do. It's attacking areas where there are toxins present. And so when these toxins are present, the body knows it needs to go after them and clear them out. And unfortunately, these toxins are within certain cells of the body, and those cells become damaged. So, as again, if you've been listening to the podcast, I'm always talking about it's toxins, and infections, right? Infections create their own toxins. So, if you want to sum it up in one word, it's toxicity. And in this world, our livers have not been designed to deal with such toxicity. So when we wind it back and we think about, okay, what is causing this high blood pressure? The blood vessels are becoming more narrow, right? As plaque gets laid down, the vessels become more narrow, more narrow. It's harder to get that blood through, increases the pressure. So let's just check. And how many different kinds of blood pressure medications are there? Half a dozen, right? Because everybody's different and people's high blood pressure may be coming from different sources. Cholesterol, right? Why is that getting high? Anytime the blood vessels are damaged, right, the liver gets a signal to create more of this low density lipoprotein, LDL. And LDL is actually a band aid that goes to that vessel to create a seal. Blood vessel walls, like our gut walls, are one cell layer thick, very easily damaged. So the LDL ideally should create a band aid. And then the good cholesterol, right, your high density lipoprotein should come along, chew up that band aid, and then everybody go on their merry way. However, in this world of 100,000 plus chemicals, we are being assaulted with toxins day in and day out. And therefore, the LDL keeps getting layered on there, right? It can never really catch up with that toxin load. So instead of reducing cholesterol, which is one of the most important substances for good cellular health, cholesterol coats every single cell in our body. That healthy saturated fat is what allows nutrients to come into the cell and allows for toxins to be released. If we don't have enough good cholesterol, that cell membrane gets replaced by more toxic fats, the oxidized omega 6 fatty acids, right, that we're consuming in processed heated foods, which is not good. That becomes very rubbery. It doesn't allow the free exchange of these nutrients and toxins, which is so important for vitality. So, the other interesting thing, the research is really showing that instead of this, fatty acid lipid profile imbalance causing heart disease, that it could be much more about infection. And one of the most common infections that we see is from oral bacteria. It's estimated that over 50%, maybe up to 80% of adults in the US do have some form of gum disease. Now, gum disease doesn't have to hurt, right? And some people think, oh, well, I'm bleeding when I floss, but that's just because, oh, maybe I was too aggressive with the floss. You should never, ever have bleeding in your gums unless you traumatize it, with a sharp something, right? But simply flossing and brushing, you should never have bleeding, right? That is a sign that something wrong, right? When you suddenly get a bloody nose, that's not shoot, okay, no, it's not no big deal, right? You cut yourself, you're bleeding, there's a problem, there's trauma, or something happening there. So please be aware that if you have bleeding gums, that is a sign of gum disease. And we need to get that sorted out because if you have gum disease, every single time you swallow, you're swallowing that oral bacteria. It's getting into the gut, creating leaky gut. Every time you chew and you push it down into the gums, it's getting into the circulation. There's tons of blood vessels all around in our gums, around the teeth, and that gets directly into circulation. Certain bacteria, we call them red complex bacteria. One of the biggest baddies is P. gingivalis, Porphyromonas gingivalis, and that's been associated with almost every chronic disease that exists: heart disease, kidney disease, dementia, low term birth rate, cancers, all sorts of bad things. And these bugs, again, Power podcast from last February of 25 really went into the details of how exactly, if you really want to know the mechanism, go back and listen to that podcast. And I talked really about all the toxins that these bacteria give off and how they specifically create foam cells and inflammation within the blood vessels. But again, it is the toxins coming off of these bacteria that cause the damage to the blood vessels. And that is when, right, the liver is signaled to create some LDL. So we can stop the band-aid, right? But that does nothing for the actual cause of what's damaging the blood vessels. So we need to look for those infections. And again, gum disease most of the time doesn't hurt. So a physician doesn't think to edit. You might not think to speak about it because again, it doesn't hurt. Yeah, I bleed occasionally when I floss. You might not think much about it. So it is important that you see the dentist and make sure that you are looking for that. Now we have so many amazing low-cost saliva tests that can really look for the type of bacteria that's present. And we have different prebiotics, different probiotics, different mechanisms. If you're really interested, I have a fantastic course. It's a 6-week course to reverse gum disease. And although it's angled toward gum disease, if you follow my recommendations, you're going to heal from almost any chronic inflammatory disease. Because again, when we reduce bacteria, we reduce inflammation, the body is able to heal itself from just about anything. So at the end of the podcast, there's always a link. Check that out. Maybe, it's a new year. Maybe that's the time to get the gums super, super healthy, reverse all that chronic inflammation that's going on. And I would love to help you with that. So check it out. But again, let's think about what could be causing that. So, and the dentist is great and very helpful, but a lot of these things, I created that course because, access may be a problem. Finances may be a problem. So you can do a lot of this stuff at home and you don't necessarily have to see the dentist. Now we have a lot of extra tools with lasers, specific red light, ozone, all these things that are really helpful, especially initially in the diagnosis and treatment, but then you can be empowered once we get that infection under control to maintain it that way, right? We've got to eat right. We've got to exercise. We have to use targeted supplements that will really help get that inflammation down and recreate that balance, right? The goal is not just to kill all oral bacteria, but how do we recreate that balance so that we have more of the healthy bacteria that create more or better immunity versus worsening immunity and more chronic inflammation. So I want to leave you guys with that, a short and sweet podcast today. But please, if you have heart disease, if you know someone who has heart disease, get your saliva checked, right? We have lots of tests. There's bristle tests, oral DNA. There's maybe half a dozen, if not more, of tests that can be easily done at the office. Could be anywhere between $100 and $200, but worth it. I mean, how much are you spending on your high blood pressure medication, your high cholesterol medication? And what are the side effects that come with that? Wouldn't it be great if you could uproot the actual cause of the high blood pressure and the cause of the high cholesterol and not have to have tons of medications that may cause other side effects? A lot of these medications further tax your liver. They further tax the mitochondria, which are the energy organelles that create health for us. When the mitochondria get that bogged down by toxins, by infections, by these medications, they're not able to produce that ATP to give us energy. How many of us would love to have a little bit more energy like we did, when we were kids? I think just about all of us would love that. We don't realize, that's not listed on the side effect, right, of most medications that we're taxing the mitochondria. So, again, for more detail, listen to my podcast from February 2025 and go check those gums, everybody. See you on the next one.
Huge thanks to you, our amazing listeners, for helping us climb into the top 5% of podcasts in the oral health space. With all the love and support, we've been getting many requests for one-on-one consultations. So we made it happen. Are you ready to take your oral health to the next level? Click the link in the show notes to book your personalized consultation, and let's kickstart your journey to a healthier, brighter smile starting today. We'll see you then.